Alaikum and welcome into the 11th match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL powered by Wilson's Pharmaceutical. We are into the 11th match that is between LGH Battlers versus LNH Galaxians. It is in fact second match of Group D and we have already got 3 Super 6 teams from Group A, B and C. Today we are blessed with the kind presence of Professor Mohammad Ishaq Saab. He is Patron-in-Chief of Cardiometabolic Premier League and he is Professor of Cardiology at KIHG Karachi. Along with him, we have with us Professor Azizur Rahman Saab. He would be umpire of today's match. He is Professor of Medicine and Senior Vice President of PSIM. And today, the moderation will be moderated by Dr. Qurban Khan Saab. He is Assistant Professor of Cardiac Electrophysiology at RIC Rawalpindi. For further moderation, over to Dr. Qurban Khan Saab.
Thank you very much, Usman Saab. Welcome one, welcome all to this contest in Group D of the Cardiometabolic Premier League in association with the Pakistan Society of Internal Medicine and the Pakistan Hypertension League, powered by Wilson's Pharmaceuticals. So 36 teams are entering, some of the best brains in Pakistan, medicine trainees all around the country, and we're going to have one winner at the end, but the aim of the game is to learn and learn well. So today we have a contest between two very different hospitals, very different parts of the country. Lahore General Hospital Battlers versus Liaquat National Hospital Galaxians. I would like to remind everyone of the format of the game. We will have a coin toss, and the winner of the coin toss will decide whether to ask questions or answer questions. And there will be a case scenario read out, and the teams will answer 10 multiple choice questions, usually best of 5. Each correct answer scores 6 points or 6 runs. You get 0 for an incorrect answer. We've had some fierce competition in this season, and if the teams are level, there will be a runoff and a sudden death scenario will take place. So I would like to introduce the teams first of all. So can we have Lahore General Hospital Battlers on screen? Let's introduce the teams. Hello, Lahore, can you hear me?
Yes, we can hear you.
Okay, could the captain of your team introduce yourself and your team members?
Yeah, my name is Dr. Talha Asif. I am from Medical Unit 3, Lahore General Hospital, third year resident. With me on my right, there is Dr. Abda. She is second year resident. And next to Dr. Abda is Dr. Samra. She is also third year resident. And to my left is Dr. Babar, who is second year resident.
Thank you, Dr. Talha. Who is your coach and who mentored you for this competition?
Yeah, so our coach is Dr. Farah Sadiq and our mentor is Professor Farah Shafi.
Wonderful. And I'm sure they're supporting you from the sidelines. Wish you the best of luck, Lahore General Hospital. Can we have Liaquat National Hospital on screen? Liaquat National Hospital, welcome to the Cardiometabolic Premier League. Can the captain introduce themselves and their team members first?
Yeah, I'm Dr. Fahad. I'm the fourth year resident. Besides me is Dr. Basir, is a third year resident. Dr. Sabahat, she's a fourth year resident. And Dr. Sana, she's also a fourth year resident of medicine.
And who
department.
coached you and who mentored you for this competition?
Our coach is Dr. Samir Abbas and mentor is Dr. Karimullah Makki. Thank you.
Well, wish you the best of luck. I'm sure your mentor and coach are supporting you as well. So without further ado, let's get on to the coin toss. Liaquat National Hospital are on the screen. So Liaquat LNH, I want you to call heads or tails. It's an electronic coin toss. If you win the coin toss, the major decisions in the game are in your hands. You'll decide whether you want to ask questions or answer questions. So let's roll that coin. Liaquat, pick heads or tails. Roll the coin.
Heads.
Is it heads? Is it tails? It's tails. No problem. Liaquat, you've lost the coin toss, but many a match has been won after a lost coin toss. So don't worry about that. Can we have Lahore General on the screen, please? Lahore General? You've won the coin toss.
We will do first.
So you want to ask questions first or answer
We will answer
questions?
first.
You want to answer first. Okay, it's in your hands.
We will answer first.
Great.
Yeah.
You will answer first. So I want you to choose. We've got two case scenarios. Case scenario A and case scenario B. Which one of these?
My
it's
lovely
totally
Dr.
random.
Qurban, sorry to interrupt you. Can you increase the volume? Sound the volume come hai. So difficult to.
Technical team, can we increase the volume?
Thank you.
Wonderful.
I
so-
think
Case A.
it's
All
hard.
right.
Probably there is a problem at your end because we see his voice very clearly, loudly.
So case
I
A
accept
has
that.
been chosen. Case A has been chosen by Lahore General Hospital. So LGH battlers, you will answer questions from the scenario of case A. So what will happen now is that Liaquat National Hospital shall read out the case scenario and shall read out the questions, and each question will have 1 minute to answer the question. So let's get to the first case A, the case scenario. Liaquat National Hospital, can you please read out this case scenario? Case A. Liaquat.
So patient is basically a 46 years old male patient presented to you in emergency department with 20 minutes history of the substernal chest pain radiating to the left arm, aggravated with walking, but it relieved on the rest. Chest pain was associated with palpitations, sweating, and nausea. He is a known case of hypertension for which he was advised amlodipine 5 milligrams once daily, but he was non-compliant to the treatment. His father died due to MI at 68 years of an age. He was a bank manager and was a known smoker with 10 pack year history. On examination, a middle-aged man, slightly obese with a BMI of 27, oriented but nervous with a pulse of 110 beats per minute that was regular, with a blood pressure of 160 by 90 millimeter of the mercury. The respiratory rate was 28 breaths per minute. Saturation was 98% on the room air, and he was afebrile. On the CNS, chest and precordial examination, along with abdominal examination, was insignificant. ECG revealed sinus tachycardia, chest X-ray, echo were normal, and cardiac enzymes were negative. Positive findings in the lab result were cholesterol of 220, LDL 190, and HDL 32. All was in the milligrams per deciliter.
So, LGH battlers, that is your case scenario, case A, as read out by the LNH Galaxians. So, let's move on to the first question. LGH, are you ready? Let's
Yes.
have LGH on screen. So, you're ready? You understand the case scenario. Let's start with question 1. LNH Galaxians, please read out question 1 and the options, please. Liaquat National Hospital, please.
After initial management, your
The
patient is
first question
stable and
that
discharged. What is the next most?
After initial management, your patient is stable and he was discharged. What is the next most important non-invasive test on the next follow-up visit to confirm your diagnosis?
Read out the options.
Stress echo, myocardial perfusion scan, exercise ECG, cardiac CT, or cardiac MRI.
The clock starts now. You've got 60 seconds. So this patient with chest pain and requires a non-invasive test on follow-up. You've got the options of stress echo, myocardial perfusion scan, exercise ECG, cardiac CT, or cardiac MRI. So let's have Lahore General on screen, please.
Answer is C. Exercise ECG.
Okay, so you've got time. You've got 60 seconds. Captain, is that the opinion of all of you?
Yeah.
You've got time to confer. So I'm going to lock it in. Can I lock it in? Should I lock it in? Exercise ECG,
Yeah, lock
option
it.
C. Okay, exercise ECG, lock it in. Are they right? Yes. Yes. They're off to a flyer. They're facing the fast bowler, and he's bowled a delivery at 90 miles an hour, but it's short and wide, and they've cut it. And they've cut it hard. It's gone over the boundary for 6. Well done, LGH. Brilliant. So 6 runs on the board after 1 delivery. Great. Perfect score. Let's move on to question number 2. Liaquat National, read out the question and the options, please.
You ordered exercise ECG testing in this patient and you told your juniors that he will be marked positive for the ischemia if his exercise ECG will reveal horizontal ST elevation more than 1 millimeter, up-sloping ST elevation more than 1 millimeter, down-sloping ST elevation less than 1 millimeter, down-sloping ST depression more than 1 millimeter, and up-sloping ST depression more than 1 millimeter.
Okay, a bit of a word salad there, but 60 seconds. The clock has started. Exercise ECG is the topic. Can you turn your microphones on, Lahore, please? All discussion has to be recorded.
D.
Is that B for brother or D for doctor?
D for dog.
D for dog. Downsloping ST depression more than 1 millimeter. No time to discuss. Let's lock that in, please. Yes, they've done
Lock
it.
it.
The confidence is there. They're facing a fast bowler again, and even though they're facing a fast delivery, they've charged down the pitch and smashed it over his head across the long on boundary for another 6. So that's 2 deliveries and 2 sixes. A very, very confident start from Lahore. That's going to be hard to match. Let's move on to question number 3, Liaquat National
A very
Hospital.
good start, by the way.
That's endorsed by Professor Ishaq.
Patient was a little worried about his cholesterol levels. The 2018 ACC/AHA guidelines for the dyslipidemia recommend statin to reduce cardiovascular events in asymptomatic individuals include all of the followings except 10-year atherosclerotic risk of 7.5% or more, diabetes aged 40 to 75 years, clinical atherosclerotic disease, LDL more than 190, cholesterol more than 200 milligrams per deciliter.
Be careful with the wording of this question. You've got 5 options. Lahore General on screen, please. Need to hear what they're saying, please. Can we have the microphone close to you, please? I still can't hear you.
I'll go with E. Cholesterol more than 200.
Option E, cholesterol more than 200. Is that the opinion of all of you?
Yeah, lock it.
Okay, let's lock that option. LGH locked. And they're correct. So the opposition are using their spinner. The spinner has bowled a full delivery, but they swept it out of the ground for 6. Slog sweep for 6. Very confident start by LGH battlers. So 6-6-6, the mark of the beast. But let's move on. Question 4.
After confirming the diagnosis of ischemic heart disease, you want to start statin to control the cholesterol levels in this patient. According to the guidelines, which of the following is graded as high intensity statin? Rosuvastatin 20 milligrams, atorvastatin 20 milligrams, simvastatin 20 milligrams, pravastatin 40 milligrams, or pravastatin 80 milligrams.
The clock has started. Statin therapy, high intensity. LGH on screen, please.
I will go with A. Rosuvastatin 20 milligram.
Okay, that was very quick, very decisive. Are you sure? We've got time. We've got 40 seconds.
Yes, sure.
Okay, we can't really hear a lot of discussion or dissent going on, But okay, let's lock that in. A, rosuvastatin, 20 milligrams. Are they right? Are they right? They're right. A devastating start. Devastating. So once again, they've hit a cover drive off a full-length ball, and it's gone over long off for 6. So a wonderful outcome, and a lot of pressure being put on Liaquat National Hospital right from the get-go. But I'm sure they'll fight back too. Score is 24 from 4. Question number 5, please.
Patient got complete relief with anti-anginal therapy. Which of the following medication is expected to improve his life expectancy? Linolazine, nebivolol, nifedipine, nitroglycerin, and ivabradine.
Start the clock.
Beta nebivolol.
Okay, quick answer there from Lahore. I think they must have conferred. I couldn't really hear because there's only one microphone apparently. Is that the opinion of all of you?
Yeah, lock it.
Okay, lock that. Answer B, yes. Yes. They've charged down the pitch to the spinner. The spinner was trying to stump them out, but they've managed to get a hold of it and slog it down the leg side for another 6. Great start by LGH battlers. They're really living up to their name. A score of 30, perfect score from 5 deliveries. Brilliant performance. Question 6, please.
As per guidelines, you wanted to start beta blocker in this patient. Which of the following among beta blocker should not be used to treat his angina? Carvedilol, metoprolol, pindolol, bisoprolol, and nebivolol.
The clock has started. LGH on screen, please. Half of the time has elapsed, 30 seconds left. Take your time.
Pindolol C.
Option C, Pindolol. Is there a consensus there?
Yeah.
Okay, wonderful. Lock in option C, Pindolol, please. Yes. Yes. You're really putting pressure on the bowling now. You're hitting good balls out of the ground for 6. So this time a full-length ball, pulled to the leg side for another 6. Surprising everyone. Great performance by LGH. Perfect score of 36 from 6 deliveries. Let's move on to question 7.
Patient said that his mother was asthmatic, but you still started beta blocker in him, considering the expected benefits. Beta blocker are contraindicated in all of the following conditions except bradycardia, bronchospasm, acute pulmonary edema, compensated heart failure, cocaine-induced ACS.
So another question on beta blockers.
Decompensated heart failure.
Okay, D for compensated heart failure. Very decisive there from Lahore. Is that the opinion of all of you? Are there any dissenting voices or any disagreements?
Decompensated heart.
Okay, compensated heart failure. Let's lock that in for Lahore. Yes, yes, yes. Magnificent, absolutely magnificent performance with the bat. So the opposition are disheartened and they're bowling their medium paces in order to try and trick you, but you're smashing it out of the park again. So that's another 6. That's brilliant. 3 more questions. Will Lahore get a perfect score? That's what I'm wondering. 3 more questions to get a perfect score for Lahore. Question number 8, please.
On his next visit to your OPD, this patient had bronchospasm on his chest auscultation. You decided to change the beta blocker with a calcium channel blocker. Among the calcium channel blocker, which of the following is or are approved for angina? Nisoltepine, feodipine, isarbidine, nifedipine, and all of the following.
Calcium channel blockers. LGH on screen, please. Half the time has elapsed, Lahore, but you still have plenty of time. Consult, discuss.
C. Isradipine.
So you're going for option C. You've got time. Is that the option of all of you? Is that your final decision?
Wild guess.
Okay, it's a wild guess. That's fine. You're allowed to do that. Lock in option C, please. Oh no. Disappointed. They were overconfident. They were playing really, really well, hitting everything out of the park. But then the opposition came up with their pièce de résistance and their bowler bowled an in-swinging Yorker that cleaned out their off stump, and now it's flying across the ground. So, first mistake by Lahore General Hospital. Tough question. And we'll move on. Let's see how much more that they can score.
Patient was little concerned about his disease after the failure of beta blocker now. His family doctor told him to use ranolazine. Which of the following statement is true about ranolazine? It reduces the exercise duration, no effects on the heart rate and the blood pressure, cannot be used as monotherapy, can be used with rifampin, reduces the mortality in the patient.
Question about ranolazine for Lahore General. Let's have Lahore General on screen, please. The battlers. Half the time has elapsed.
C. Cannot be used as monotherapy.
Okay, C cannot be used as monotherapy. Is that the opinion of all of you? You have time to disagree, you have time to change.
Yes.
Okay, that's final. C. Lock that in. Oh no, ranolazine. Ranolazine has no effects on heart rate or blood pressure. So another incorrect question answered by Lahore General. They tried playing the spinner aggressively. They charged down the pitch, but they were stumped out by the keeper. The bails are off. So out again, but one last question. Still a very, very good score due to they came out like a house on fire in the initial part of the competition, and they still have a chance of an excellent score if they get the next question right. The battlers have one more question left. Let's take it away. Question 10.
3 months later, patient underwent invasive coronary angiography, but it didn't reveal any obstruction in the coronaries. According to 2020 ESC guidelines, what will be the most important test to determine the cause of his disease? Electron beam CT, PET scan, CT FFR, or cardiac MRI?
The clock starts now. Most important test to determine the cause of disease, according to the 2020 ESC guidelines. Thirty seconds gone. Fifteen seconds.
D. CT-FFR.
CT-FFR. We have to lock that in. There's no time for compromise. Oh no, it was cardiac MRI. It was cardiac MRI. So on your last delivery, you've tried a quick run and the fielders have been quick and they've thrown it to the keeper and he's whipped the bails off and you're run out on the final delivery. So you've scored reasonably well. You started brilliantly. You got 7 questions correct out of 7, but then unfortunately 3 incorrect answers in a row, but it's still a very competitive score and it'll make the competition extremely interesting going forward when Liaquat National Hospital Galaxians answer their questions. So I would like to get some feedback from our umpire, Professor Azizur Rahman, and see what he thought of the performance of LGH battlers. Can we have Professor Azizur Rahman on screen, please? Assalamu alaikum, sir. Welcome.
Well, Assalamu alaikum. Thank you very much. And LGH took a brilliant start. I was very sure they were going to score maximum marks, but something happened. I don't know what happened. They started having trouble. I think I would like to have their opinion if they have any reservation about the validity of the 3 questions they dropped. I will be able to answer them because all the questions were verified, referenced. So
No, sir, it was... No, sir, we have no objection. They were very good. Just our lack of knowledge.
Well, you performed very, very well in the beginning. I think maybe some questions were difficult, but that is how this MCQ is constructed. So best of luck. Still, you have, I think, not lost. Match is still on.
Thank you, sir.
Thank you.
Thank you. Well done, Lahore. I think you can be very proud of your performance. I think this game is not about winning or losing. It's about learning and gaining knowledge. And I think it's an excellent start, as Professor Azizur Rahman did say. And now we are going to move on to Liaquat National Hospital Galaxians, and we'll see how they perform. So can we have the other case scenario on the screen? Lahore, please read out the case scenario.
A 32-year-old female presented to you with fever, flu, headache, fatigue, muscle and joint pains. She was treated as upper respiratory tract infection and was discharged on conventional antibiotics. Her PCR and it came out to be positive. She had no comorbid or significant past history. She was recently married and had secondary amenorrhea for the last 1 month. 10 days later, she presented in ER with complaint of non-specific chest pain for 2 hours and shortness of breath with orthopnea and PND for 6 hours. On examination, a young female of average built and height, responding to commands but agitated, pulse 110, BP 110/70, respiratory rate 30, oxygen saturation 92, and temperature 101. Chest examination revealed bibasilar fine inspiratory crept altering with cough. CVS examination revealed tachycardia and gallop. JVP was not raised and there was no pedal edema. ECG showed sinus tachycardia. TLC, CRP and ESR were raised. Drop I was positive but CKMB was negative. BNP was 190. CXR revealed signs of pulmonary congestion with mild cardiomegaly. Echo revealed LV dysfunction with EF 45%, but LV chamber size was normal.
So LNH Galaxians, did you hear that? Can we have LNH on, please? Did you read the case history and did you hear it?
Yes, we have to.
All right. You have to keep your microphone on if that's okay, because now you're answering questions and we need to know what your discussion is. So keep your microphone on. Let's get to the first question with this scenario. Question 1.
What is your diagnosis? NSTEMI, peripartum cardiomyopathy, Takotsubo cardiomyopathy, dilated cardiomyopathy, myocarditis.
LNH on screen, please.
It's myocarditis E.
Option E, myocarditis. That is your answer to the first question. Are you sure? Is that all of your line of reasoning? You're sure?
Yes, it is.
So I'm going to lock that in Let's lock in option E, myocarditis. Yes, brilliant, brilliant. You've gone after it. You have really gone after it. The ball is outside off stump. You've hit it towards the offside, and it's gone past the field and over the offside boundary for 6 runs off your first delivery. So you've put pressure on the bowling side immediately. That's a wonderful start, myocarditis. Question number 2. Let's begin.
What is the first line treatment of this case? Captopril, metoprolol, furosemide, spironolactone, or dapagliflozin?
A young woman comes in with these symptoms. What's the first line of treatment?
It's C, furosemide.
Okay, they're very, very confident. They've had a discussion, so I think let's lock that in and see how they do. Yes, yes, brilliant, brilliant confidence from LNH Galaxians. That's great. Very, very decisive, very, very determined. Furosemide is the answer, first line of treatment in this case. So the opposition have bowled outside off stump again, and you've square cut it. You've square cut it over third man, and it's gone for another 6. So 2 deliveries and 2 sixes. Perfect score of 12, but there's a long way to go yet. Let's move on to question 3.
4 days after admission, echo was repeated and EF was now 35 and LV chamber was significantly enlarged. What is your diagnosis then? Hypertrophic cardiomyopathy, dilated cardiomyopathy, restrictive cardiomyopathy, peripartum cardiomyopathy, or Takotsubo cardiomyopathy?
Start the clock.
It's B, dilated cardiomyopathy.
So they've gone via a process of exclusion, but we've heard the discussion, so they've eliminated the other options. And is that your final answer? Galaxians, your final answer?
Yes, it is B, dilated cardiomyopathy.
Okay, let's lock in B. They're sure about it. Are they right though? Yes, they're correct. Absolutely decisive. Wonderful decision making by the Galaxians. So 3 deliveries and 3 sixes. This time they've charged down the pitch and hit it well over long on, above the bowler's head, above into the sight screen for 6 runs. So 18 points from 3 questions fielded. Let's move on. Galaxians are charging ahead.
All of the following signs are expected in this patient described in question 3 except S3 Gallup, cardiomegaly, raise, JVP, Rales, Friedrich sign.
So we're talking about clinical signs. Which one is not expected in this patient?
हाँ तो अभी पूछ रहा है ना थर्ड क्वेश्चन में अब होगी और कोई ऑप्शन है समझ में आ रहा है और कोई ऑप्शन समझ में आ रहा है रेल्स में मिलेगी तो गो फॉर E
15 seconds. Can I have your
It's
final
E,
answer?
Friedrich sign.
Okay, Friedrich sign. Let's lock that in. Brilliant. Brilliant by Galaxians. You utilized all of your resources, you took all the time you needed, and you went through a process of exclusion. Excellent teamwork by the Galaxians. So the opposition tried their spinner, but the spinner's bowled a long hop, and you've pulled it on the onside boundary for a big 6 out of the stadium into the park. So great performance by Galaxians. 24 points from a possible 24. You've got 6 questions left. You need to get 4 of them right to win. Next question, please.
As per guidelines, the patient was treated as a case of systolic dysfunction. All of the following can cause diastolic dysfunction except hypertrophic cardiomyopathy, dilated cardiomyopathy, restrictive cardiomyopathy, constrictive pericarditis, or cardiac tamponade.
डायरेक्टेड कार्डियोमायोपैथी है
All of the कई चीजें systolic
मैं बता रहा हूँ ये कह रहा है कि ये ट्रीट किया हमने सिस्टोलिक डिस्फंक्शन यानी कि डायलेटेड कार्डियोमायोपैथी था All of the following can cause diastolic dysfunction. Diastole नहीं हो रहा सही, hypertrophic करा सकता है, restrictive करा सकता है, constrictive करा सकता है, tamponade करा सकता है, dilated cardiomyopathy नहीं करा.
हाँ sorry
हाँ. Go for B.
It's B, dilated cardiomyopathy.
And that's the opinion of all of you?
Yes.
Okay, let's lock that in. Are they right? Are they right? Yes. Once again, ingeniously done. The process of elimination, they eliminated the incorrect options and they went for the one that they thought was the best fit, and they were correct. Dilated cardiomyopathy is the correct answer. So once again, they're playing that spinner and they've charged down the pitch again and they've hit a big 6 over long off. So another 6 points, and the score is perfect. Perfect. 5 questions asked, 5 questions correctly answered, a score of 30. They were within, they can almost sense it, they can smell the victory. It's close. But how close is it? We'll see. Next.
Regarding the advantages of treatment in heart failure, how the following are likely to reduce the mortality in this patient except captopril, spironolactone, dapagliflozin, furosemide, metoprolol?
So a question about mortality reducing drugs. Which
It's
one?
D, furosemide.
That was very decisive, very, very quick answer. So is that just the captain or is it all of you?
All of us.
Well, that's universal. So we seem to
Yes.
have some general consensus there. Let's lock it in. Furosemide, option D. Yes. 6666666. Perfect score of 36. And they've done it again. They've square cut the bowler and it's gone very, very fine, and it's gone into the crowd for another 6. Well done. So now they have the chance to even the score with the battlers. So Galaxians, get ready for your next question, number 7.
If the echocardiography in this patient had shown EF more than 45%, which of the following drugs will reduce this hospital stay? Captopril, spironolactone, dapagliflozin, furosemide, metoprolol.
हॉस्पिटल स्टे कम करने के लिए हॉस्पिटल स्टे करने के लिए
देखो more than 45 है ना, non complex है.
बीटा ब्लॉकर ना.
In this patient यार देखो बात सुनो. In this patient सुनो. इस पेशेंट में आप बीटा ब्लॉकर दोगे ही नहीं. हार्ट फेलियर है, लेकिन ये कह रहा है कि more than 45 है. तो हार्ट फेलियर विद रिजर्व इजेक्शन फ्रैक्शन है.
देखो
नहीं, ये बोल रहा है
हॉस्पिटल स्टे कौन कम करेगा.
if the echocardiography in this patient had shown EF of more than 45, तो फिर कौन सी यूज कर सकते थे अगर तो शो करता. आई थिंक इट इज बीटा ब्लॉकर.
ही नहीं
कोई काम बीटा लो लिया.
कर दो बिस्मिल्लाह.
It's E, metoprolol.
Is that the opinion of all of you?
Yes.
All right, let's lock it in. Let's see what they've done. Are they right? Are they right? No. No, in this patient with heart failure with mildly reduced ejection fraction, the option guideline directed was dapagliflozin.
होगा सही
So
होगा.
that was found in the DELIVER trial recently from 2022. So unfortunately, Liaquat National Hospital were a bit overconfident. They swished at a good length ball and they're caught in the slips. First slip has taken a fine catch, and Liaquat National Hospital have made their first critical mistake. Is it going to be a fatal error? Only time will tell. Let's move on.
In the main scenario, the BNP was 190. All of the following statements are true except monitor heart failure in patient using ARNIs expressed primarily in the ventricles, less specific in old age, less specific in women, less specific in COPD.
So we're talking about BNP here. BNP.
प्राइमरली इन वेंट्रिकल्स होता है.
लेवल भी ठीक है. मॉनिटर
सही
भी लेकर है. ठीक है. लेस
यूजिंग अर्नीज, यूजिंग अर्नी का पता करो कि अर्नीज है.
ठीक है.
हाँ सही, ठीक है. लेस स्पेसिफिक इन COPD, लेस स्पेसिफिक इन वुमेन, लेस स्पेसिफिक इन ओल्ड एज.
COPD में भी स्पेशल राइट वेंट्रिकल वॉल्व
बढ़ जाता है. इंडिरेक्ट बढ़ाएगा BNP तो लेस स्पेसिफिक पता नहीं है.
Remember, you're looking for the false statement.
हाँ, लेस स्पेसिफिक इन
एक्सेप्ट बाकी सब में तो है
अरे कौन सा फॉल्स स्टेटमेंट बोल रहा है तो एक्सेप्ट
एक्सेप्ट
सारे सही है
ऐसे स्पेसिफिक से कुछ तो सही हो
Look for the statement that doesn't seem right.
तू एक्सेप्ट बोल हाँ बोल दे
C less specific in old age
Bit of a guess there. Let's lock in option C. No time to change. No. The answer was A. Bit of speculation there, but now you've put yourself under real pressure. You tried playing with your pads to the bowler. The leg spinner bowled a googly and it's gone right through the gate and whipped off your bails. You are out. So now you are under real pressure. You've got 2 questions left. 2 questions left. In order to win, you need to get both of them right. In order to tie with LGH battlers, you need to get one of them right at least. So let's move on.
Statements are true about use of thiazide diuretics in this patient, except I can't read the options clearly.
Okay, let me do it. Question number 9. All of the following statements are true about the use of thiazide diuretics in this patient, except A. Controls hypertension better than loop diuretics. B. May be used for mild fluid retention. C. Hydrochlorothiazide can be used in patients with GFR less than 30 mL per minute. D. Metolazone can be used in patients with GFR less than 30 mL per minute. E. Hypokalemia is a side effect. So, which one is the incorrect statement? You need to look for the incorrect statement. Time starts.
मेटानिक्स है ना
नहीं वही है मेटानिक्स है
मेटालोजोल
तो 30 से कंप्लीट करते हैं जब ये ना
हाँ
मेटानिक्स तो सही तो नहीं
तो यार आई थिंक
Welcome to Dr. Samar Abbas, who's joined our podcast. Welcome to you, sir.
थायराइड डायरेक्टर्स हम एक है कि नहीं दे रहे होते यूजुअली
यार ऐसा थायराइड डायरेक्ट्स हम दे तो रहे होते हैं
यार कोई इजी लेकिन अच्छा होता है ना वो
Half the time is gone. Remember, you're looking for the incorrect answer.
I think C बोल दे less than 30 बोल दे
थायराइड कैन बी
ठीक है तो सब में सी लग रहा है
हाइड्रोक्लोरोथायजाइड कैन बी
C
So you've got 12 seconds left. Are you sure it's C?
yeah sure
Okay, they're sure. Lock it in, please. Brilliant! Under pressure. Under pressure, under pressure. And they've come out with it. They have come out with it. They've gone down the pitch and they've whipped that delivery, that full-length ball, down the leg side for 6 runs. It's gone for 6 in the tightest of circumstances, and now we really are down to the wire.
Now comes the decisive question, Paravan.
Let's go for it, sir.
decisive
Question number 10. This will determine whether you win or whether you go off into a runoff. So let's ask that question. LGH, please.
Your colleague wanted to start beta blocker in this patient. Among the beta blockers, all of the following have strong evidence of lowering mortality except carvedilol, short-acting metoprolol, bisoprolol, extended-release metoprolol, or nebivolol.
So which one of these have strong evidence, don't have strong evidence of lowering mortality? So it's a negative question. So one of these is incorrect. So you need to pick the one which doesn't lower mortality.
इधर लिखा
ना होता है एक की नैनो टेंस होती है की होती है इससे ये डिफरेंस होता है उससे स्टैंडर्ड
टाइट्रेट का बेनिफिट है
बिसो है ना कार्बेट है नेबिल है सही
शॉर्ट एक्टिंग लोगों से शॉर्ट एक्टिंग क्या होता है
शॉर्ट एक्टिंग कर दो
This is to win it.
बिस्मिल्लाहिर्रहमानिर्रहीम बी फॉर बिस्मिल्लाह
Okay.
It's B.
That's the logic. You've discussed it. You're sure. I think let's lock it in. B for Bismillah and B for short acting metoprolol. Are they right? Are they right? Can they win it? Yes, they won it. In the most extreme pressures, in the most tightest of circumstances, Liaquat National Hospital have pulled it out of the bag. It was looking unlikely for a while, but they managed to get their head straight. They really have played it to perfection. They've timed their final run brilliantly. Well done, 𝐏𝐚𝐤𝐬𝐬 National Hospital. That was a very, very, very fine performance by you. That was so competitive, getting a score of 48. Congratulations on winning this match. So I'd like to ask the winning team. Dr. Samar, you are the coach of 𝐏𝐚𝐤𝐬𝐬 National Hospital, Galaxians. Would you like to say something about the victory? So I think we've lost Dr. Samar there for a while. Can we have the Galaxian team on, please? So Galaxians team, can we have a few words from you? How did you feel?
Hello.
Yes. Say a few words.
Hello.
Yes.
Yeah,
can
it
you say
was a
few-
great it was a great match. It was a great match, and thanks a lot for such a platform to provide such a sort of a match, and it was a good experience actually for us.
Wonderful.
Everyone, sorry.
So do we have Dr. Samar back?
Yes, I'm here. Hello, how are you? Assalamu alaikum, everyone.
Congratulations. Congratulations, Dr. Samar. Your team performed splendidly.
Yeah, perfectly, because I saw the whole match and it was a tough competition. And, we, whatever the team we have, it's the best team in our hospital at the moment. So I'm lucky that we won, and I'm thankful to everyone here. So wonderful performance by everyone here. Even Lahore General Hospital performed very well. So that was perfect. And I think congratulations to Fahad and his team. That's all I want to say.
Thank you, Dr. Samar. Many thanks. Can we have Lahore General Hospital on? I think they performed so well and they had such an amazing start. Can we have LGH Battlers on, please? LGH Battlers, you really lived up to your name. You fought very, very hard. You did wonderfully well. You performed excellently at the beginning, just fell off at the end. Would you like to say a few words? I think everyone appreciates your efforts.
Thank you, everyone, and we really appreciate such activities should held on regular basis, and it was a very healthy activity, and we are looking forward to having more such. Thank you very much.
Great. There are no losers in this competition. Everyone gains something. So whether you go through to the next round or not, you certainly do gain in knowledge and in experience. And it's a national platform you expose to the wider world. So well done for a wonderful performance, Lahore General Hospital. You just weren't able to make it this time, but still you came out with a lot of credit, and I think everyone at your institute should be very proud of you and your team. Well done. I'd like to invite Professor 𝐏𝐚𝐤𝐬𝐬𝐿 for his comments on the competition.
It was really a treat watching this match. I think both the teams performed very well, and I really enjoyed it thoroughly. And I'm glad there was no ambiguity in the questions, and no team raised any objection to the question. I think they all were validated and referenced and very, very relevant. So looking forward to such matches in the future also.
Great. Thank you very much, Professor 𝐴𝐸𝐸𝐬𝐿. Is Professor Ishaq available?
Yes, I'm very much there.
Your comment, sir,
see
was a
me?
brilliant competition.
Well, thank you very much first of all for having me. I thought you have maybe forgotten that I was already there throughout the match. Brilliant performance from both the teams. Very, very interesting. The questions, I must compliment the person who has framed the questions. They were cardiology questions, and I think they were very nicely answered. It gives me some level of satisfaction that our generation has done a reasonable job, and our youngsters are really well educated now, and they are well articulated, thanks to teachers like Professor 𝐵 Rahman and others who have taught them how to answer the questions. I think brilliant performance from Lahore General and of course from 𝐏𝐚𝐤𝐬𝐬𝐬𝐿 National. Of course, one team has done a little bit more and managed to pass the exam with margin. But I think there's no losers. We are all winners, and it's the knowledge that is being highlighted, being learned, and being exchanged between the teams, between the fellows. And above all, the most important thing is it brings the communities together. Fellows living in Lahore and fellows living in Karachi, talking to each other, exchanging their views, and listening to them. I think this is a great effort by Wilson to integrate the medical profession across the country. There was just one minor comment that I wanted to make about the use of calcium channel blockers in angina pectoris. I think it was slightly because we don't use dihydropyridine derivatives in angina anymore. If there was anything which was used was diltiazem. I wish that was there. So I think it was a bit tricky, that question. Otherwise, the rest of the questions were fine and well answered. And thank you for your very nice moderation. We didn't feel any absence of Dr. Hamza in your presence. And thank you to Wilson for organizing all this. And I would like to congratulate both the teams, and I would like to appreciate their efforts, and they should not go from here that they have lost or anything of the sort. I think they have done very well. Thank you.
Thank you very much. Thank you very much, Professor Ishaq. Very insightful comments as always. So here we have it, the end of this contest. A very, very brave and spirited performance by Lahore General Hospital battlers. But in the end, it wasn't enough to overcome the brilliance of Liaquat National Hospital Galaxians. There was not much in it. It was just one question right at the very end where they pipped their opponents. But a truly magnificent contest. Great questions. Very challenging, very stretching for the competitors. But finally, we are at the end of this contest, this Group D contest, in this, the Cardiometabolic Premier League Match 11, powered by Wilson's Pharmaceuticals and under the umbrella of Pakistan Society of Internal Medicine and the Pakistan Hypertension League. The competition is hotting up as we get further and further, deeper and deeper towards the Super Sixes and eventually towards the Grand Final. From me, Dr. Qurban Khan, and the rest of the team at Wilson's, thank you very much for being a part of this broadcast. Allah Hafiz.